Good morning. Today we will talk about an important topic, that is fatty liver. Fatty liver. Liver has got fat deposits nowadays. Almost in India, one third of the people, in every three people, one person has got fatty liver. Whenever anybody is going for check, that is a scanning of the abdomen, the report says fatty liver grade 1. Fatty liver grade 1, that is grade 1 is the beginning. So fatty liver has become a very common problem among Indians. One third of Indians, they have fatty liver. And what exactly is fatty liver, we will discuss. See, liver is a 1500 gram, that is 1.5 kg, biggest gland in the body. It lies just below the, just under the lower rib cage, right lower rib cage. From here to here, right lower rib cage, it is there just below the chest, and in the abdomen. So left side there is stomach, we know that. Left side there is stomach, right side there is liver, 1.5 kg. This is biliary tract. There is a separate circulation called biliary tree or biliary tract. This is liver, 1.5 kg liver. It secretes bile, that green fluid. Whenever we vomit, we will get some greenish discharge, that is called bile. Okay, it is very important for food digestion, So this is liver, and the bile will come out with this duct. This is a small duct, and here is gallbladder. We see gallbladder stones are very, very common nowadays. This one is gallbladder. This bile which comes from this tube is stored in this gallbladder, and this is connected with common bile duct to the small intestine. This is intestine. So whenever you are taking food, the gallbladder contracts and the bile gets into the small intestine to get into the food and digest it. This is the circulation. This is called biliary tree and biliary circulation. So very important for digestion. Liver has got multiple functions. It is a very good scavenger. That means it takes out all the dirty material in the food and detoxifies them. Suppose you take alcohol, liver is the one which tries to detoxify it. You take any poisonous things, if any poisonous things are there in the food, liver is the thing that detoxifies them. And not only that, liver is the organ. Suppose you take food, suppose you are taking food, ultimately any food which you take gets converted to glucose, that is sugar. Okay, and this sugar, which is used for the total body, for the muscles, for the bones, for your brain, for your all the organs, this particular sugar which is used, if something is left over, for example, there is some amount of unused calories. Suppose you need 1000 calories, you have eaten 1500 calories. That 500 calories which is converted to glucose, which is not used up by the body, is converted to fat by the liver. Is this sugar, this particular glucose which is not used by the body, is converted into fat by the glucose and stored in this particular glucose is converted to fat, and this particular fat is stored in the liver. That is the function of the liver. And suppose you have not taken food for one day, so naturally the liver is the first organ to react. It releases the fat, and so glucose is converted to glucose, and it comes into the circulation to help you. This is how the liver acts. So liver is taking up the extra sugar or extra glucose which is there in the body and storing it in liver. So this is the problem where fatty liver is the ultimate presentation. Fatty liver is mainly seen in diabetics. Fatty liver is mainly seen in diabetics. And number two, obese individuals. When do you call a patient obese? When do you call a patient obese? If his body mass index is about 23, 25. If 23 to 25%, 25, above 25, we definitely call it obese. If the BMI is 25, definitely body mass index is 25, we call them obese. So obesity is one reason for fatty liver. Number two, diabetes. Diabetes is one of the important reasons for fatty liver. Here there is always a confusion. All the diabetics, they have fatty liver. All the diabetics, they have fatty liver. And all the fatty liver patients, 90% of them, they have diabetes, or they develop diabetes in due course. This is almost like vice versa. All the fatty liver patients, in due course, they develop diabetes. So this is the thing. But all the diabetics, they are almost having fatty liver. So obesity is another reason. And taking these are all the things. And taking excessive fructose by cokes, by the form of cool drinks, that is cokes, excessive fructose, taking excessive fructose, packaged foods and sodas, packaged foods, all these things. You see so many bakery products, chips, etc., packaged foods, they are also the reason for your fatty liver. They are also the reasons for fatty liver. Lack of exercise is another important thing. See, exercise, what exercise does is it releases endorphins, it releases myokines, and one more thing is it uses up the calories which you already taken. The amount of calories you have already taken from food, the exercise uses them up. Exercise spends them out, so burns them out. So lack of exercise is another reason. People are not doing proper exercise. That is also one of the reasons for your fatty liver, for your fatty liver. And there are two types of fatty liver. We are talking about non-infective, non-alcoholic fatty liver till now. Non-infective and non-alcoholic fatty liver till now. See, there is one thing called alcoholic steatohepatitis, that is alcoholic fatty liver. So, alcoholic steatohepatitis. So, we have been till now discussing about non-alcoholic steatohepatitis, which comes with food, mainly your food, your lifestyle, your diabetes, your other problems, thyroid, etc. These are all the reasons. These are all the things which cause non-alcoholic steatohepatitis. Now we'll discuss about alcoholic steatohepatitis. Most of the things, this is alcoholic fatty liver. So most of the people, they have a feeling that if I have 2 pecks per day and take good food, I will not land up in trouble. That is also a myth. See, alcohol, whichever quantity, in whatever form you are taking, is dangerous, because alcohol directly gets absorbed in the stomach, whereas the food you are taking with alcohol gets absorbed in the intestines. So alcohol goes first from the stomach directly to the liver, and it already damages. So very, very important. So most important thing is alcohol in any small quantity also causes fatty liver and complications. One more important thing is infective hepatitis. There are 5 infections: A, B, C, D, E. That is A, B, C, D simply. So hepatitis A, hepatitis B, hepatitis C. We know hepatitis B, hepatitis C. Everybody knows nowadays. Hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. So hepatitis A is mostly seen in children when they take outside food, outside water, contaminated water, etc. Hepatitis E is seen in adults, is seen in elderly people, in adults, where if they consume outside food, contaminated food, etc. But hepatitis B and hepatitis C and hepatitis D, these are blood-borne. These are blood-borne. They come from blood through injections, through blood transfusions, through body fluids, and by sexual route, however, in whatever form, other things like AIDS and all they come. No, so same body fluids, through body fluids. This is transmitted: hepatitis B, hepatitis B, hepatitis C, and hepatitis D. These three are transmitted only from blood through injections, through blood transfusions, so through body fluids, through whatever, through contamination of body fluids, by sexual route or whatever it is. So important thing is, say nowadays you have treatment for hepatitis A, you have treatment for hepatitis E, you have treatment for hepatitis B, you have treatment for hepatitis C also. Hepatitis B and hepatitis C are totally treatable nowadays, and hepatitis B can be prevented by vaccination. Hepatitis B can be prevented by vaccination. Even hepatitis A also. Nowadays they are given to children. Hepatitis B can be prevented by vaccination. Hepatitis C, there is no vaccine. But hepatitis B and C, they are curable, they are treatable nowadays. Excellent medicines have come for it. There is good treatment for hepatitis C and hepatitis B also. But these are the infections. These are the infections which also cause fatty liver, and once there is already fatty liver, this infection, that is hepatitis, further damages them. What are the sequelae of fatty liver? For example, see, 5% of fat in liver is very common. 5%. For example, there is 1500 grams liver. 5% in it is acceptable, it is normal. But anything more than 5%, up to 10%, we call it grade 1. Up to 20, 25, 30%, we call it grade 2. More than that, we call it grade 3. And it is nearly 60%, we call it grade 4. So, grade 1, grade 2, grade 3, grade 4, this is fatty liver goes up, and ultimately the liver totally gets disturbed and it gets fibrosed, because there will be a inflammatory change in the liver. There will be, because this much of fat occupied the liver, there will be inflammation in the liver, which causes fibrosis, toughness in the liver. It was soft till then, it becomes tough. It's called fibrosis. Fibrosis ultimately leads to liver cirrhosis. That means liver is totally gone. It gets shrunk, and it becomes like almost like a very tough organ. It doesn't function. You need to have liver replacement. You need to have replacement surgery, liver replacement surgery. So this is transplantation, liver transplantation. So it is not an easy procedure. It is 20 to 25 lakhs nowadays, and you have to get a donor also. It is not easy. So very difficult. Liver is the organ. Once if it is damaged, it is very difficult to. But one thing is great thing in liver is it has got regenerative capacity. Even if little bit is damaged, it regenerates. Very fast regeneration will be there. But there is gross insult daily. You are going on insulting liver daily with so many foods, lack of exercise, worst foods like inflammatory foods, we call them. This fructose, cokes, packed foods, sodas, alcohol, all inflammatory foods, if you are giving daily, naturally there is no time to recover. And lack of sleep. Lack of sleep is another reason which causes fatty liver. So ultimately the liver gets damaged and becomes, first fibrosis starts liver, later cirrhosis of liver is the last complication, and you land up in trouble, and ultimately only transplantation of liver is the only, liver replacement surgery is the only method, which is very, very expensive. So how to prevent these complications? Number one, first thing is good sleep for 7 hours. Good sleep for 7 hours is very important, and you have to change your dietary habits. You have to change your dietary habits. Number one is you try to take fresh vegetables, uncooked vegetables. At least 30 to 40% of your diet should be uncooked vegetables. Like whatever vegetables you can take uncooked, you have to take. For example, carrots. You can take carrots, you can take kheera, you can take tomatoes, etc., etc. Whatever you like, uncooked vegetables, at least 30 to 40% in your diet. And then millets, because low glycemic index foods. Why we stress on millets is because they have got lot of fiber, about 9 to 12% of fiber. So you have to leave white rice, you have to leave rice you have to leave, wheat you have to leave. Rice, wheat, sugar, jaggery, maida, these are the 5 danger things. You have to leave them. Come to millets which have got low glycemic index. You can take all low glycemic index foods, particularly millets which have got very good fiber. They are very, very useful in reversing your fatty liver. And one more thing is fresh vegetables. Coffee, don't take tea, coffee. But milk is also not advised. Sugar is also not advised. So coffee, black coffee, at least 2 cups per day. 2 cups per day will help in detoxifying, that is reducing the fatty liver to some extent. Coffee is good, you can take 2 cups per day. But sugar and milk are to be taken very, very moderately. They are not good. Okay. And next comes avoid paracetamol. You have to avoid drugs like paracetamol. People are nowadays taking excessive paracetamol. In UK and US, you see paracetamol hepatopathies, like liver problems more. So paracetamol, as much as possible, try to avoid. If needed, only take tablet. And herbal supplements should be avoided. Herbal supplements also dangerous. They must be avoided. Herbal supplements should be avoided. This is an important thing. Herbal supplements, by the name of herbal supplements, we are taking poisons. Try to avoid. And particularly this fatty liver, first it will be grade 1, next it will be grade 2, next it will be grade 3, next it will be grade 4, finally fibrosis of liver, and ultimately cirrhosis of liver. Liver is completely gone. Take care.